Question. The patient with a head injury is experiencing increased intracranial pressure. The neurosurgeon prescribes mannitol. Which intervention should the nurse implement when administering this medication? 1. Monitor the patient's arterial blood gases during administration. 2. Do not administer if the patient's blood pressure is less than 90/60. 3. Ensure that the patient's cardiac status is monitored by telemetry. 4. Use a filter needle when administering the medication. Answer. Option 4 is correct. Explanation. The nurse must use a filter needle when administering the osmotic diuretic mannitol because crystals may form in the solution and syringe and be inadvertently injected into the client if a filter needle is not used. Option 1 is incorrect. The patient's arterial blood gas are not affected by the administration of the osmotic diuretic mannitol. Therefore, there is no need to monitor them. Option 2 is not correct. The patient's blood pressure does not affect the administration of the osmotic diuretic mannitol. Option 3 is not correct. The patients with a head injury would be in the ICU receiving telemetry, but the osmotic diuretic mannitol does not affect cardiac status. Question. Which of the following statements is true regarding the impetigo? Select all that apply. 1. It is the most common bacterial skin infection between the ages of 2 and 5. 2. The trunk is the area most commonly affected by impetigo. 3. The causative agent of impetigo is Haemophilus influenzae. 4. Impetigo is not usually a systemic infection. Answer. Options 1 and 4 are correct. Explanation. Option 1. This is a true statement. Impetigo is the most common bacterial skin infection amongst 2 to 5-year-olds. It is highly contagious and precautions should be taken to prevent the spread of the disease amongst families, daycare centers, and schools. Option 4. Impetigo is not usually a systemic infection. In most cases, the infection is confined only to the skin where the sores break out, most commonly the area around the nose, mouth, hands, and feet. Topical antibiotics can usually treat impetigo. The child is well appearing other than the obvious skin infection and usually remains afebrile. Option 2 is incorrect. The trunk area is not the most common site affected by impetigo. The area around the nose, mouth, hands, and feet are the areas most commonly affected by impetigo. Of course, the infection is highly contagious and may spread to other areas of the body, especially if the child scratches the sores on their face and then touches other parts of their body. Option 3 is incorrect. The causative agent of impetigo is not Haemophilus influenza. Causative agents can include Staphylococcus aureus and group of beta hemolytic streptococcus. Haemophilus influenza is the causative agent of bacterial meningitis, not impetigo. Question. The RN is teaching the client diagnosed with angina about sublingual nitroglycerin. Which statement indicates the client needs more further teaching? 1. I will always carry my nitroglycerin in a dark-colored bottle. 2. If I have chest pain, I will put a tablet underneath my tongue. 3. If my pain is not relieved with one tablet, I will get medical help. 4. I should expect to get a headache after taking my nitroglycerin. Answer. Option 3 is correct. Explanation. The client should put one tablet under the tongue every 5 minutes and, if the chest pain is not relieved after taking 3 tablets, the client should seek medical attention. This statement indicates the client needs more teaching about the medication. Option 1 is incorrect. If the NTG, a coronary vasodilator, is not kept in a dark-colored bottle, it will lose its potency. This statement shows the client's understanding of the medication teaching and that more teaching on that topic is not necessary. Option 2 is incorrect. Sublingual NTG is placed under the client's tongue when chest pain first occurs. The patient understands the teaching. Option 3 is incorrect. NTG causes vasodilation and will cause a headache. The client understands this. Question. The RN is assessing a client's neurological status and notes 4+ deep tendon reflexes. Which of the following conditions would not be a possible cause of hyperactive, deep tendon reflexes? 1. Hypocalcemia. 2. Muscular dystrophy. 3. Upper motor neuron lesion. 4. Hyperthyroidism. Answer. Option 2 is correct. Explanation. Hyperactive deep tendon reflexes, DTRS, would not be expected in a patient with muscular dystrophy. Muscular dystrophy DTRS are typically decreased or absent. Option 1 is incorrect. Hypocalcemia, low calcium level, is a potential cause of hyperactive DTRS. Option 3 is incorrect. The presence of an upper motor neuron lesion is a potential cause of hyperactive DTRS. Option 4 is incorrect. Hyperthyroidism is a potential cause of hyperactive DTRS. Question. The RN is caring for a patient with narcolepsy. Which of the following medications would the nurse anticipate the primary health care provider prescribe? 1. Olanzapine. 2. Modafinil. 3. Ropinirole. 4. Quetiapine. Answer. Choice 2 is correct. Explanation. Modafinil is a psychostimulant that is effective in treating narcolepsy. This medication promotes wakefulness and is dosed either once or twice a day. Options 1, 3 and 4 are incorrect. Olanzapine and quetiapine are atypical antipsychotics and not indicated in the management of narcolepsy. Quetiapine is highly sedating and would be counterproductive in the management of narcolepsy. Ropinirole is a dopaminergic and is indicated in treating Parkinson's disease and restless leg syndrome. Educational objective. Narcolepsy is a syndrome in which a patient has significant daytime sleepiness that often lessens after a nap. Stimulants such as modafinil and armodafinil are indicated in the management of narcolepsy as they promote wakefulness. Common side effects of modafinil include headache, nervousness, anorexia, and weight loss. Question. A nurse is working in the pediatric ward. A 2-year-old client is experiencing epistaxis. Place the appropriate nursing interventions in the correct sequence. 1. Apply ice pack to the bridge of the nose. 2. Apply pressure to the nose for at least 10 minutes. 3. If bleeding continue, insert cotton into each nostril. 4. Keep the child calm and quiet. 5. Help the child to sit up and lean forward. Answer. This is the correct sequence. 1. Keep the child calm and quiet. 2. Help the child to sit up and lean forward. 3. Apply pressure to the nose for at least 10 minutes. 4. If bleeding continue, insert cotton into each nostril. 5. Apply ice pack to the bridge of the nose. Explanation. The priority nursing action to take is to keep the child calm and quiet. If the child becomes distressed and is crying, it will exacerbate the bleed. Next, the nurse needs to sit the child up and lean them forward. Many parents think they should pinch the child's nose and tilt their head backward, but this will not aid in stopping the bleed and can be an aspiration risk. Do not let the parent tilt the child's head back. Next, begin applying pressure to the nose and check to see if the bleeding continues after 10 minutes. If the nose is still bleeding, the next action would be to insert absorbent cotton into each nostril. If the nose continues to bleed after that, the following priority action is to apply ice to the bridge of the nose to aid in vasoconstriction, thus stopping the bleed. Question. The nurse is assessing a client's post-coronary artery bypass graft. The nurse is implementing measures to address the nursing diagnosis of ineffective airway clearance related to retained secretions and excess secretions. Which nursing intervention is the least appropriate? 1. Administering aspirin before to deep breathing and coughing exercises. 2. Splinting the incision site with heart pillows or pillows before coughing. 3. Assisting the client to ambulate as tolerated. 4. Teach the client the correct use of an incentive spirometer. Answer. Option 1 is correct. Explanation. Aspirin is an NSAID that has an antiplatelet property. Administering aspirin to the patient may put the patient at risk for postoperative bleeding. The patient needs opioids to manage his pain, not aspirin. Option 2 is incorrect. Splinting the incision site before coughing promotes more intense coughing efforts. Therefore, It is an appropriate nursing intervention. Option 3 is incorrect. Respiratory effort is increased with ambulation, therefore, deep breathing occurs, helping to clear chest secretions. Option 4 is incorrect. The correct use of an incentive spirometer encourages sustained inspiration to open alveoli, promoting the clearing of chest secretions. Question. The patient in chronic heart failure is prescribed Milrinone lactate. Which priority intervention should the nurse implements? 1. Assess the client's respiratory status. 2. Monitor the client's telemetry strip. 3. Check the client's apical pulse rate. 4. Evaluate the BNP. Answer. Option 2 is correct. Explanation. Milrinone lactate, Primaker, is a phosphodiesterase inhibitor. Primaker inhibits the enzyme phosphodiesterase, thus promoting a positive, inotropic response and vasodilation. Severe cardiac dysrhythmias may result from this medication, therefore, the client's telemetry should be monitored. Option 1 is incorrect. The client's respiratory status should be evaluated, but the cardiac status is priority for this medication. Option 3 is incorrect. The client's cardiac status, including pulse rate, heart sounds, and blood pressure, should be monitored, but the client's telemetry reading is the priority. Option 4 is incorrect. The BNP is a laboratory test that is useful as a marker in the diagnosis of CHF. Normal is less than 100 picograms per ml, however, this test is not a priority when giving a patient Primaker for already diagnosed CHF. Thanks for watching. Subscribe and watch playlist for more videos.